Hello everyone, I'm Kate. Today I want to talk to you about mammograms. There's very little out there by women going through this experience, and I really couldn't find a lot by actual real ladies. So here we are. I thought I would change all that. Hello, I'm Kate. Welcome to I Love 50, a channel dedicated to motivating and inspiring every single woman over 50 and beyond. Hello everyone, I'm Kate. Today I want to talk to you about mammograms. Because of a personal experience that I had a few weeks ago, I really just decided I was going to make a series of videos to actually talk about mammograms. What they are, why we have them, what happens during a mammogram and what happens afterwards. So I knew mine was coming up. I was looking for more information, but it really seemed to be mainly information made by medical channels and health centres, which of course is great. It's super, super helpful, but there's very little out there by women going through this experience. And I really couldn't find a lot by actual real ladies. So before we get started, I need to say that I am not a qualified or licensed medical or health professional. I am not giving personal health care advice of any kind. You always need to talk to your doctors to discuss what's appropriate for you. Most clinics will recommend that women and their doctors discuss the benefits, the risks, and the limitations of mammograms, decide together what is best. You need to balance the benefits of screening with the limitations and the risks. It's a key part of deciding when to begin your mammograms and how often to repeat them. Mammogram guidelines are likely to change in the future as researchers continue to study this topic, so keep getting advice from your doctor. So now that is said, let's get started. So to prepare for your mammograms, obviously choose a certified and reputable mammogram facility or clinic. Try and schedule your test for a time when your breasts are least likely to be tender. So if you haven't gone through the menopause, then that's usually during the week after, maybe before your period. If you've had a mammogram done before, if you're going to a new clinic, then bring your previous mammogram images with you. They will also ask you not to use deodorant before your mammogram. So avoid using deodorants, antiperspirants, powders, lotions, creams, all that kind of stuff under your arms or on your breasts. And the reason for that is that those little metallic particles in powders and deodorants can be visible on your mammogram and they will cause confusion. So what exactly is a mammogram and why do we have them? Well, we have them to check for the early signs and symptoms that can lead to the many different types of breast cancer. Basically, a mammogram is an X-ray of breast tissue that can detect the changes that are too small to be felt during a usual physical examination. A so-called screening mammogram is used to check for breast cancer in ladies who at that stage have no symptoms or signs. And depending on where you live, it is typically recommended that women from about 40 to 45 onwards would have a screening mammogram maybe every 1 to 2 years, and this will vary on your local recommendations. So check with your doctor to see what's recommended in your local area. Now, if you've actually found a lump or have any other signs or symptoms, then typically a diagnostic mammogram is used. And the mammogram will confirm, ideally, whether those changes are benign, non-cancerous, and nothing to worry about, and no further treatment is needed, or whether the changes indicate possible breast cancer and further tests and treatment might be required. So then sometimes these tests prove inconclusive, which means that they can't rule out the possible breast cancer at this stage, and you will need to have some further tests. Okay, so let's look at what actually happens during your mammogram. So once you've gotten your appointment, you would generally have the check done at your local clinic, health centre, hospital. So, and while it's not all that pleasant, it really doesn't take very long. And obviously most centres are pretty practiced at this. They do many checks every day. So they have a really good set routine and it makes it quick and efficient for everyone. So that can be a comfort to some ladies out there. Once you're in there, the most common procedure that I'm aware of is that each breast is pressed between two X-ray plates which spread the breast tissue out so that clear pictures can be taken. And both breasts will be checked during the mammogram, and usually 2 X-ray pictures are taken of each breast. So this really can be quite uncomfortable. I'm not going to lie to you. Sometimes it even hurts a little bit because you're being squished between these X-ray plates, but it actually doesn't take that long. Like I said, you're holding this position, the nurse puts you in while she hits the X-ray button, and you're done. Sometimes she'll take them again just to get a better picture, but it's better that she retakes a clear and readable picture for the doctors to look at. And sometimes it's worth the short-term discomfort, and then you're done. So if you do a little bit of reading around the risks and the benefits, some reviews of breast screening programs published have found that programs reduce breast cancer mortality, and early detection of breast cancer can significantly improve treatment outcomes. The goal with any screening program like this is to minimize the potential harms, maximize the early detection of any tumors. The potential risks include inaccuracies, radiation exposure, overdiagnosis. Some of us have dense breast tissue, and this can make it tricky as they can find things that aren't cancer related at all, but they have to check them out, right? It's initially nothing to worry about. Overdiagnosis describes the diagnosis of cancers which, undetected, would not have caused any symptoms or health problems in a patient. It can lead to unnecessary treatment and distress. Overdiagnosis occurs because mammography cannot accurately distinguish between potentially fatal cancer and a less harmful cancer. So you need to discuss all of these concerns with your doctor and think about whether these benefits of the mammograms outweigh any potential harms. So how do you get the results of your mammogram? Well, check with your doctor about how the results will be made known to you. Sometimes these results will be mailed to you, and obviously with your consent also to your doctor. What happens afterwards? Well, the radiologist will look for evidence on your x-rays of cancer or non-cancerous and benign conditions that might require further testing, follow-up or treatment. Possible findings can include calcium deposits, which they call calcifications, which can happen in your breast ducts, also other tissues, masses, lumps, asymmetric areas on the mammogram, dense areas appearing only on one breast or another specific area on the mammogram, new dense areas that have appeared since your last mammogram. Now, if the radiologist notes areas of concern on your mammogram, then further testing might include an additional mammogram known as a compression or magnification views, ultrasound imaging, or even a biopsy to remove a sample of your breast tissue for laboratory testing. In some situations, they may do an MRI scan in areas where the current imaging or ultrasound is negative, it's not clear what's causing the breast change or abnormality. So if you get a letter saying that there's an area of concern, then it is not immediately something to panic about. So getting a call back after a screening mammogram is fairly common, but it can be scary. So getting that call or letter does not immediately mean that you've got breast cancer, but the doctors have found something, maybe a bit suspicious looking, something that they want to have another look at. So if you do get called back, it's generally within a week, and they will want to take some new pictures, give you some more tests. So if it's your first time having a mammogram screening and they find something, then remember that they've got nothing to go on. It's your first time. There's no previous imaging for them to compare to. So they might haul you back in to get it checked. And apparently this is really, really common in first timers. I've read a statistic recently about 10% of women get recalled. It's also common in women who haven't gone through the menopause yet. But this is exactly what happened to me. So more on that in the next video.